Welcome to Legal Nurse Podcast. This is your spot to get inspiration, tips, stories, and guidance to help you in your legal nurse consulting practice. I'm Pat Iyer, the host of Legal Nurse Podcast since 2016. We are among the top 5% of all podcasts in the world in terms of longevity and sharing information consistently week after week with legal nurse consultants. Sit back, relax, and enjoy the show. We're going to focus now on the important role of reports in converting prospects into happy clients who keep returning to you over and over again. So, Barbara, let's start first of all with why legal nurse consultants and the reports they create are such a vital part of a legal case. How does what we do contribute to the attorney's strategy?
This is such a great question, and this is something that you and I have been asked multiple times by legal nurses, both at our conferences and other sessions that we have led. And the legal nurses report serves as the bridge between the complex medical records and the legal process, and it helps attorneys understand the relevance of the medical issues in the case. For example, it clarifies medical jargon for the legal professionals, because as you know, medical records are filled with terminology, abbreviations, there's clinical language that attorneys, judges, and juries may not understand. And a legal nurse translates that data into plain language, enabling legal teams to grasp what's happened medically and also how it relates to the legal questions at hand. These reports also highlight the key issues. These legal nurse reports identify and they distill the clinical events, timelines, deviations from the standard of care, and potential causation or harm. And by doing that, that helps the attorney focus on the most relevant aspects of the case rather than wading through hundreds or even thousands of pages of medical records and charting. And in addition to that, these reports help to establish timelines. A well-constructed legal nurse report outlines the chronological sequence of events such as injury, diagnosis, treatment, complications as examples, and it's essential in determining liability, causation, and damages in both plaintiff and defense cases. And then certainly these reports assess standard of care. As legal nurses, we can analyze whether healthcare providers met or deviated from the acceptable standards of care. And the expert interpretation is pivotal in cases of alleged malpractice or negligence. These reports also, they support or they can refute claims. So it can strengthen or weaken a case by identifying what the gaps are in the care, what the documentation issues are, and if there's any undiscovered contributing factors. This report offers a balanced clinical perspective that either supports or it challenges legal arguments. And these reports also educate judges as well as juries. And in some cases, legal nurse reports or testimony is derived from these reports to serve to educate these juries and judges because they provide objective explanations about the medical conditions, the procedures, outcome, what is the informed decision-making, standards of care, and lastly, well, not lastly, there's so many things these reports can do, but they also assist in case strategy by identifying the strengths and the weaknesses and the potential expert needs early in the case. So that report will help the attorney develop more effective legal strategies including whether they should settle, whether they should proceed, or whether they need further expert consultation. So those are some of the examples. Now, I would like to explain the differences between discoverability and behind-the-scenes reports and the expert report, because the behind-the-scenes report is considered informal or an internal report, and it's typically created by attorneys or legal nurses or internal team members during case preparation. This can include internal analysis, strategy, opinions, and even initial assessments. Generally speaking, these are not discoverable. They are oftentimes protected as attorney work product, especially if prepared in anticipation of litigation. But there's always an exception. So whatever client you're working with, you'll need to know what your role is and whether or not, if you are developing a report, if you need to write confidential, if your name is going to be shared with opposing counsel. So these are a couple of things you will need to know in advance of writing a report. Whereas the expert report, this is a formal document, and it's prepared by the designated expert. That could be a medical expert. It could be the legal nurse consultant who's going to testify. And these reports should include a summary of the expert, if it's you or someone else, their qualifications, what are their opinions, what is the basis for the opinions, and what are the supporting materials. So that's really important to know.
Those are great points, Barbara. And as I was listening to you, I was thinking about a report that I made. When you talk about the difference that it can make in a case, there was a man who had a seizure who went into an emergency department in New York. He had a CAT scan of his head. It showed his head was fine. He wanted to get off the stretcher to go to the bathroom, called for help. All of the nurses listening are knowing what happened next. Nobody came. He got off. He did a face plant, as we like to say, on the floor, and ended up with a subdural hematoma. The Department of Emergency Room Records had no nurse's notes for the next 12 hours, absolutely nothing. And then he was transferred to a med-surg unit. And I told the attorney, there's missing records. My report to him as a behind-the-scenes consultant was designed to say, hey, look, there's records who are missing. Oh, no, the defense said, we gave you everything. We gave you everything. There's nothing else. He had me write up an affidavit that was presented to a judge that said simply, if you're in the emergency department for 12 hours, there are going to be nurses' notes. It's impossible that the nurses cared for him and didn't document. Then, rather sheepishly, the defense attorney found the nurses' notes, and they confirmed what the patient had told us happened, and the case resolved. Barbara, is there any example like that you've encountered where your report made a critical difference?
Yes, I was going to share that. An example would be when you're writing a report and you're giving the name, the age, the date of the surgery, for example. And this gentleman who was age 47 went into the hospital and had an open reduction internal fixation. And the allegation was a delay in diagnosis and treatment of what's known as compartment syndrome, leading to a permanent disability. So the medical summary included this gentleman's health history, what surgery he went into the hospital for, and then post-operatively, the nursing noted at 4 a.m. on March 16, increasing complaints of pain unrelieved by morphine and described as 10 out of 10 pain. And there was pain with passive stretch. However, the resident did not assess the compartments. There were no compartment pressures recorded. The nursing staff did not call the resident back when then the pain was escalating up to a 20 and 30 out of 10. And the gentleman was writhing in his bed and he was not due for any more pain medication. And the leg appeared tense and pale, and then the pulses became faint. So that was noted at 10:30, and it wasn't until 1 p.m., so 9 hours after the first signs and symptoms of compartment syndrome, that then they realized, oops, we have a problem here. And they went to the OR and they found muscle necrosis requiring multiple surgeries, debridement, skin graft, and this gentleman lost much of the muscle in his leg. He has a permanent foot drop. So in this type of report, as the expert, this is where you would address what is the acceptable standard of care in nursing and addressing increasing pain out of proportion to injury, pain with passive stretch, tense swelling. These are hallmark early signs of compartment syndrome. And you can certainly further elaborate and talk more about the nurse's responsibility. So in conclusion, the medical record demonstrated that there were signs of compartment syndrome that were present and documented, yet there was a failure to act in accordance with the nursing process and also clinical guidelines. And as a result, this delay contributed towards the permanent injury. So this is the kind of report that helps legal teams quickly understand what went wrong and why it matters. So that's an example.
Thank you, Barbara. And before we go on, I wanted to address Renia's question in the chat. And she's confirmed for me that she's noticed some experts list out their cases in the summary, and she's referring to the summary of an expert witness report. Is that standard? Most of my cases are open, and I'm not sure I should be sharing the case information. If you do list them, do you list only the ones that have gone to court or just cases you've worked on with attorneys?
Thank you for your question. So when you're writing an expert report, you would not include lists of your cases that you've worked on. I'm wondering if the attorneys are asking you more specifically for a testifying list, because in some of the federal courts, they do want a list of what depositions have you testified in and what trials have you been involved in. I encourage you not to share a list of all the cases that you're working on inside of a report, because some of those cases, you may not have been disclosed as the expert on the case. So maybe you're sharing something that the opposing counsel is, maybe they're the opposing counsel perhaps in the future of that other case. So I would discuss that with your attorney and what they're specifically looking for, but case lists do not belong in an expert report.
And the only list of cases that you are legally required to supply, according to the federal rules of evidence, are the cases in which you've been deposed or you've testified. If you volunteer in a deposition, oh yes, I have a list of all my cases, opposing counsel is going to want that list. One of the opposing counsels in a case in which I was an expert sent subpoenas to the attorneys who had their names listed on my testifying and deposition and trial list. And then my clients started calling me furious because they got a subpoena. How dare that attorney send them a subpoena? And said, Pat, do you know what he's doing? And they're not obligated to answer a subpoena. You're not obligated to keep a list of cases other than testifying and trial, deposition trial, for a total of 4 years, which I interpret as 48 months. So when I was doing a lot of cases, I would drop off cases that were older than 48 months and just give them 4 years. Let's go on, Barbara, and we'll see how we can address other questions as we have time. I wanted to ask you about the key characteristics that make a legal nurse report effective? And what should we be keeping in mind to make sure that our reports are effective when we're creating them?
The key characteristics include several things. And first and foremost, you want to have clarity and objectivity. So when you are writing these reports, you want to use concise, precise language and avoid medical jargon or explain it clearly. So if in your report you start out by giving initials, ORIF, XFIX, at least for the first time in your report, write what, in parentheses, ORIF, open reduction internal fixation, XFIX, external fixator. You don't have to carry it throughout, but at least for the first time. And you want to provide the facts without bias and stick to clinical findings and documentation. And when I talk about bias, I really want to bring this forth to you and share an example. So, for example, a legal nurse consultant with a very strong background in emergency nursing is reviewing a medical malpractice case involving a delay of a stroke in the emergency room. The legal nurse consultant strongly believes that the emergency nurses in that case were overworked and often were unfairly blamed for systemic issues. So because of that belief, the legal nurse downplayed the nurse's failure to assess neurological changes in a timely manner. She ignored the facility's policy on the neurochecks after changes in mental status, and she emphasized systemic factors without addressing the individual's nursing responsibilities. So this is what she wrote in the report. Quote, given the high workload in emergency settings, it's understandable that this assessment was missed. Nurses can't be expected to catch everything when the department is understaffed. So I ask you, what do you think the consequence of that in a report would be? I'm going to tell you what it is. It minimizes the standard of care deviation and failed to provide an objective analysis. The attorney then receives a distorted view of the case, and then that can potentially weaken their legal strategy. And if this is used in litigation or deposition, the legal nurse can appear defensive or partial, and then it's looked at. That reduces their effectiveness and it decreases their trustworthiness. So that is a concern. Other important things are you want to have a well-organized structure. Your report should have a logical flow with headings and subheadings. You want to identify a chronology of the events, especially in a timeline. Certainly, you want to talk to your attorney as to what he specifically is looking for in that timeline and summarize those complex medical records into digestible content. You want to make sure that this is a fact-based analysis, that you are relying on medical documentation and not assumptions. And you can use references such as the policies, guidelines, or authoritative sources, such as the ANA standards and/or specialty protocols, as example. Your report should be professional, have a professional tone and appearance. So what that means, and Pat Iyer is the master of writing reports and teaching about reports, make sure your reports are free of spelling and grammatical issues, because Pat and I have seen these spelling and grammatical errors multiple times, sometimes on line 1, or even beforehand, the address or the name of the attorney will not be correct. Use a neutral or professional tone. And you can divide it up so you can have a title page. If your report is really long, you can consider a table of contents and signature and date. And your report should be case relevant, directly addressing the attorney's questions or what the case theory is. You should highlight the strengths and weaknesses from both the plaintiff and defensive perspectives and include key issues. Now, legal nurses, you must keep in mind, you must know your role. Please don't offer any legal opinions because we're not attorneys. So focus on the clinical facts, care standards, expert interpretation of the medical records. I want to emphasize maintaining confidentiality. Treat the report as confidential work product unless directed otherwise. And you can label it prepared in anticipation of litigation, if that's appropriate with your client. And understand the legal context. Tailor the report based on the type of case. Is it a medical malpractice case? Is this personal injury, workers' comp, or criminal as examples? And make sure your report aligns with the state legal standards and relevance with regard to timelines. So I just want to circle back to maintaining confidentiality. Pat and I have seen in a variety of public areas on having to do with nurses, legal nurses, and attending conferences. We have seen case write-ups in a variety of listservs. And every so often the name of the facility is listed. Perhaps the plaintiff name could be listed there as well, or the defendant name. You do not want to share those identifying factors, and you certainly don't want to take your case and put it on a listserv outlining all the details of your case. You never know who's on the listserv or on Facebook or other places. You never know who's there. Could it be opposing counsel? Could it be somebody's opposing counsel's expert? You never know. So I just want to point that out to you. Make sure that when you are working on these reports that you are staying within your scope. So when you're testifying, you stay within your clinical expertise and avoid overextending into areas beyond nursing and medical facts. And be prepared for scrutiny. I encourage you to read your report multiple times, checking to make sure everything makes sense. Your report can be used in court or in deposition, and ensure every statement can be supported by the documentation or the accepted standards. So those are my points for you.
Thank you, Barbara. And to clarify a little bit, to make sure that we are clear, if you're behind the scenes and you are not a testifying expert, you can share strategy suggestions. You can highlight the strengths and the weaknesses of the case, anticipate what the other side is going to argue. That report is not discoverable. However, if you're an expert witness, you're focusing on the strengths of the case from the standpoint of the side that you are working on. You don't necessarily say, if you're a plaintiff expert, here are all the things that the nurse defendants did correctly, and here are the things that they did not. Your focus is on the deviations from the standards of care. There was a question in the chat that I'll address before I ask Barbara my next question, which is, how do you focus on those deviations? Typically, when you write an expert report, you summarize the medical events after listing all the documents that you reviewed, such as admission to St. John's Medical Center from this date to that date, admission to WellCare nursing home from this date to that date. Whatever it is you had at the time you wrote the report, then you summarize the medical events. You then define the standard of care. What would the reasonably prudent nurse do when in this situation? And then, as a plaintiff expert, and the question was specifically about nursing home cases, you identify the federal regulations that impact on your analysis. What do the federal regulations say that the nurse should have done? And how did the nurse deviate from those regulations? And then your conclusion: to a reasonable degree of nursing probability, you believe that the nurses at this facility deviated from the standard of care. You summarize your opinions, and then you end your report. The other question in the chat, which is broader, is, are there standard components or sections to the report? Denise, it depends on what kind of report you're writing. And that's a broad question that we don't have time to address, to go through all the different types of reports. If you're not clear on what the client wants, it's always a good idea to talk to the attorney beforehand, before you start your analysis, and say, what type of report are you looking for? And then you've got an opportunity to clarify expectations and give the client what they want, which is critical in terms of having a satisfied client. Barbara, let's step into one more question related to report structure, and that is, when you are encountering medical records, clearly as a legal nurse consultant, you understand how they're written, but you're writing a report for somebody who does not have a medical background, with rare exceptions. Some attorneys are physicians, dentists, pharmacists, but the vast majority of them are not. And how do you keep that in mind when you're writing a report? I'm Pat Iyer, bringing to you information about our June 5th, 2025 workshop. This is a day that we have set aside to help you learn how to more clearly and more efficiently evaluate a nursing malpractice case. With Barbara Levin and I at your side, you will have an opportunity to learn how to identify the 4 elements of malpractice and how standards of care will guide your analysis. We're going to cover the difference between being a behind-the-scenes consultant and an expert witness, and what type of information you should gather from the attorney-client during that first phone call that you get about the case. We'll talk with you through a set of medical records based on a real case, so that you can determine the case merits and get hands-on experience looking at the elements of malpractice. You'll learn how to use research and literature to support your opinion. What sources should you be checking out based on the issues in these medical records? And you'll discover tips for presenting your findings clearly, whether you're screening the case or you're writing a full expert report. Barbara Levin and I are both experienced expert witnesses and will guide you based on our experiences in evaluating cases. Sign up for our June 5, 2025 workshop, Analyzing a Nursing Malpractice Case, by going to this link, lnc.tips/analyzing. You'll have an opportunity to join us for that full day. And if you see this podcast after the event is over, you can invest in the recordings and get the benefit of what we shared. The link again is lnc.tips/analyzing. I will see you there.
Well, legal nurses, they translate their findings into the insights for the attorney, and they do that by first providing a thorough medical record review. So legal nurses systematically examine all the relevant records, including admission and discharge, nursing notes, physician notes, operative notes, all the medical records, medication administration records, diagnostic tests, vital signs, trends, and Those are just examples. And legal nurses, we look for inconsistencies. Is there missing documentation? Are there delays in care that might signal a deviation? In addition, we compare and take a look at standards of care, whether the care provided aligns with the nursing practice standards. As I mentioned before, the American Nurses Association, the specialty standards, hospital policies and procedures, clinical guidelines, evidence-based practice as examples. And we will evaluate if the assessments were done timely. If there were any changes, we're going to note, was a provider notified appropriately? Were interventions delayed or omitted? Were complications identified and addressed? We also look at identifying omissions and errors and common red flag issues include incomplete or absent documentation, such as the case that you just presented, Pat, about no documentation in the emergency room with someone who fell. Failure to monitor or reassess changes in condition. The example of the compartment syndrome case that I gave to you, there were 9 hours of delays, medication errors or issues, failure to follow physician orders, perhaps there's a delayed escalation of care, failure to perform, going back to my compartment syndrome case, the neurovascular assessments. And we also connect the dots. So as legal nurses, we don't just point out the errors, we have to connect the dots. So did these deviations contribute toward the patient's deterioration or harm? We have to determine, was there a missed opportunity, a missed window for intervention? And could an earlier time of detection or action have changed the outcome? So that's really important for us to note. With regard to an analysis report, there is a role of doing an analysis report versus a chronology or a summary. A medical summary or chronology is a presentation of the facts. And oftentimes this would be something that the behind the scenes legal nurse would be providing for the client, presenting facts in a neutral timeline. It could be a timeline, it could be a brief summary form, and this helps attorneys understand the flow of events. It's factual, it's concise, without opinion or implication. And depending upon what your role is, it may be discoverable, depending upon the use of this, because sometimes these medical summaries are shared with experts. That would not be your role as a legal nurse to then go share this with a potential expert. That would be up to the attorney if he directed you to do so, or if he took your report, your medical summary chronology, and he shared it forward. An analysis report is done also by the behind the scenes. And the objective of this is to provide pluses and minuses of the case. So these reports guide an attorney. The question may be, is there a case or is there not a case? What are the weak spots? What are the strengths? So in this type of report, you are going to provide a summary of the key facts, identify the deviations or the strengths in the case, what is the clinical impact, what are the case weaknesses or the defenses, and what do you see as recommendations for the types of expert witnesses or further review. So generally speaking, this is not discoverable if protected as attorney work product. So I encourage that if you are writing this type of analysis report, that you write that on the report in bold at the top. It's generally speaking not discoverable, especially if you are not testifying. Make sure that your tone in the report is analytical and strategic and candid. And make sure that you always label this type of report as confidential, as I mentioned before, attorney work product. And you can also say prepared in anticipation of litigation. Be clear about which documents are for disclosure, which are used for internal versus external. And this is something that you would discuss with your attorney client.
And Barbara, I've got more questions for you. Before we continue, could you discuss with our listener what are the components of the workshop that is coming up? This is taking place on June 5th from 10 a.m. Eastern to 4:30 p.m. Eastern. We've planned this program to focus on analyzing nursing malpractice cases. Can you share with our listener, what are we going to be covering that day?
Absolutely. Well, I've got some questions for all of you who are here. And this just gets to the heart of what Pat and I are going to be doing on June 5, 2025. This is going to be a day-long workshop. It'll go from 10 a.m. until 4:30 p.m. Eastern time. And we deliberately start our programs at 10 a.m. because we know that our colleagues out on the Pacific Coast would love to join us. And that's 7 a.m. their time. And I know 7 a.m. is early. We're nurses. 7 a.m. is what we're used to all over these years. So we want you to have the opportunity to ask questions such as, how do you tell that the nursing malpractice case has merit? This is something we're going to be discussing. And if you're not sure about that, then there's one of the ways that we're going to address that question through our workshop. We are going to work with you through the whole process from the time the attorney calls you on the telephone about a case to the point that you can identify the red flags and analyze the case. So sometimes answers are not always obvious, and it requires us to go do a medical literature review, find supporting information that is going to help you analyze the case. So are there seminal research articles? Is there key nursing data? Is there an organization that offers standard of care that addresses the particular issue? And we're going to talk about the differences between screening cases and the types of reports that you will write in that instance versus when you're an expert witness or you're writing a report screening cases and you're behind the scenes. So you might be working in-house as an employee, or you could be an independent legal nurse. You can put down in writing, in reports, a summary of what happened and your suggestions for an attorney. So we are going to help you prepare that type of report that's not discoverable by the opposing counsel. And when you're the expert, what you write down is discoverable. Sometimes new experts don't realize that. And Pat and I have seen reports with comments in them that were not something that the opposing counsel should have seen. And we have some good examples of those blunders. So we are going to focus on those two types of reports. This is a day in which we're going to go through the 4 elements of malpractice, how the standards of care are going to help you with your analysis. We'll talk about the differences between behind the scenes review versus if you're retained as an expert, and why it's so critical that when you get that phone call from the attorney, you know how to conduct that phone call, how to find out what your role will be. And Pat and I have heard stories, and I hope it's never happened to you, that the LNC got a call, wrote a report thinking that they were behind the scenes, and then the attorney said, That's great. I'm going to name you now as the expert. And you're thinking, well, no, I had not planned on being the expert. I'm not qualified to be the expert. That gets really awkward. And I have seen some of our legal nurse colleagues that their reports have been filed as the expert, and they themselves were not notified that they were named as the expert until later. So that can be a big mess. And we want to help you avoid going through that. So what are we going to do, you may wonder? We are going to provide you a set of medical records. This is a real case that I worked on, and you're going to have the opportunity to analyze these records during this full day workshop. And we are going to focus on checking literature, talking about standard of care. We're going to help you analyze the data. Our hands-on workshop is going to give you the chance to work on a case. And some of you have worked on cases and some of you have not. So I'm sure you'll welcome this great opportunity. And you'll be able to do more work and come back to your office with practical skills and confidence. You will also have the opportunity to network with a great group of legal nurses from coast to coast and meet other people who are participating in the program. So we have a super early bird rate for the first 10 people who sign up for that workshop. And I know that we do have a couple people who have signed up. So I'm going to give you the site to write down and register after our session today. And that is lnc.tips/analyzing, ANALYZING. So lnc.tips/analyzing. So we'll give you the link again at the end where you can go and sign up. And we want you to put the code in where the shopping cart is so you can get the super early bird discount. And we look forward to welcoming you on June 5. Pat, do you have another question for me?
I do. And we touched on this a little bit earlier in relation to whether or not you exhibit bias in your wording. Clearly, when a person sues another person, there's a defense expert, there is a plaintiff expert. They're both looking at the same set of facts, but they're filtering it through their perspectives, perhaps their experience, their education. How can you present your findings and your opinions objectively, even if you've got a strong feeling about a case such as this is the worst care I've ever seen in my life? Why do opinions like that don't go in a report in that kind of wording?
Yes, we don't want to do that. Objectivity is the cornerstone of credibility in both behind the scenes legal nurse reports and expert witness reporting. Attorneys are relying on you, the legal nurses, to deliver clinical clarity, not advocacy. Our role is not to advocate. I've been asked that in deposition and trial. They'll say, Nurse Levin, are you here advocating for X, Y, or Z? That's not my role at all, and it's not yours either. Even when the medical facts seem overwhelmingly strong on one side, legal nurses' role is to maintain professional neutrality, and you're to present your findings based solely on the evidence. So this is how legal nurses can ensure your findings are presented objectively and effectively in both behind the scenes and expert witness reports by sticking to the documentation. Rely strictly on what's in the medical records, not assumptions, not emotions, not speculation. Use phrases such as, according to the chart, or the documentation reflects. Avoid emotional and judgmental language. So for example, please refrain from, quote, The nurse failed miserably. You don't want to use that. Instead, use neutral clinical terms, such as the standard of care was not met when neurovascular checks were not documented for 4 hours. Do you see what the big difference is? You're taking the facts and you're talking, also infusing standard of care there. You want to provide a balanced analysis. So by having a well-rounded report, you're going to identify the strengths and the weaknesses of the case. Now, if you're behind the scenes, you're going to identify the weaknesses. If you're the expert, you're not going to include those weaknesses in your report. You want to highlight strong documentation and appropriate actions and timely interventions. Attorneys are going to find more value in honest, critical insights in a report than something that confirms bias. Make sure you label your report clearly, such as confidential attorney work product for use in anticipation of litigation, as example. Now, for an expert witness report, you want to focus on the strongest, most defensible points. So your report should zero in on what are the key issues with strong evidentiary support. You want to link the standards of care, and you can include authoritative sources. You can anticipate as an expert that there may be a rebuttal from opposing experts, of course, and you too may end up coming later and writing a rebuttal report after opposing counsel's expert writes their report. You may be asked to write a rebuttal report. So those are a few tips. I want to encourage you to support every opinion with evidence. So avoid vague statements, and you can use citations from the facility's policies, standards, current literature. If you do go to deposition or trial, make sure you remain professional during the entire time. Speak calmly with confidence, facts and logic, and just remember, the final tip would be strong opinions are useful as the evidence behind them. So you have to have evidence behind your opinions. And as legal nurses, we build credibility not by being forceful, but by being accurate, thorough, and we must be impartial. And these are qualities that attorneys, judges, and juries respect.
And Barbara, I think we have time for another question, which is, let's say you're asked to screen a medical malpractice case for merit. What would be the best structure for that type of report to ensure that the attorneys can easily understand the information and the conclusions that the legal nurse consultant has?
Well, with regard to structure, you want to make sure you can use headers. You want to make sure that you have clarity with regard to a timeline. You define the breaches or lack thereof. You can talk about, you will talk about, I actually have an example here. If it were a compartment syndrome case, and once again, you want to combine your clinical insight with strong documentation linkage in there. So structuring the report, you would want to have the following: headers and a disclaimer if necessary, if depending upon if it's an analysis letter or an expert report. You don't have a disclaimer if you're the expert. You want to have, if you're the expert, an introduction. What is the purpose of the report? What is the description of the case? What is your clinical background that you're bringing forth? I mentioned the summary of care, analysis of care. I want to encourage you also that in these expert reports, you need to list all the materials that you've reviewed, the medical records, policies and procedures, depositions, name whose depositions you have reviewed. Perhaps there was a video that you were asked to watch or look at photos. Include that in your report. And those are a couple tidbits for you.
Well, thank you, Barbara. I wanted to make sure that we have a little bit of time for some questions. And if you could put it in the chat, that would be helpful. I see one person's hand is up, but I prefer that you write out your question. And I wanted to make sure that we have covered the questions that came up in the session. I'm looking at the chat, and if you have a question that we haven't addressed, please put it in the chat now.
While they're writing that in the chat, I just want to share with everyone that the best way to refine your skills and developing your skills, develop and refine them, is hands-on experience. And that's why I strongly encourage you to attend our upcoming workshop, because you're going to practice reviewing real medical records. You're going to learn how to spot critical red flags, get direct feedback on how to structure your findings. So it's one thing for you to hear about concepts. It's another thing for you to actually apply them in a safe, interactive learning environment. And that's where your confidence and effectiveness as a legal nurse really starts to take shape. And Pat and I will help you, and you will learn from your colleagues as well. We have so much to share with you. So we encourage you to attend. And I know that Pat's going to post, we'll put the website up there too. It's June 5, 2025 from 10 until 4:30 p.m.
And why don't you, while I'm checking on the page, Barbara, share any final advice that you might have on writing impactful and effective nurse reports. And I'll bring you one perspective, which is an LNC asked me a question: do I really have to prepare the report the way the attorney's asking me to do it, even though I prefer a different format? Do you want to answer that?
Well, I encourage you to talk to the attorney about exactly what he's looking for. So everything starts with a conversation, asking the attorney, what are his key concerns? What is he looking for in the report? Are you focusing on liability, causation, or both? Are you looking for a brief opinion letter, a full report, an expert report? Some attorneys want high-level screening to assess the case merit. Others may want a deep dive. And you want to understand from him, obviously, what your role will be. And you would be utilizing headers, bullet points. Perhaps you want some visual timelines. What type of report is he looking for, in a Word document, a PDF? And as you're developing this report, check in with your client to make sure that you're doing things what he or she is looking for you to do in the format that they're looking for.
And I just checked the page, and to explain, the code is gone because we have sold all of our super early bird tickets. The investment for the day is $347, which includes the materials, the recordings, the slides, the transcripts, and the opportunity to be with us all day to get your questions answered, network with your fellow LNCs and get some hands-on experience analyzing a nursing malpractice case. You're going to have practical tools that you can use right away, and the opportunity to hear and learn from Barbara and I, both experienced legal nurse consultants. I tell people about the first expert report that I wrote involving a young lady who fainted in the bathroom and cut her knee on a glass IV bottle. It was something that happened in the early 1980s, because I got the case in 1987. And I wrote a report just like I would have written a term paper at my college program. I had footnotes. I had multiple footnotes, multiple footnotes. And I sent the report to my defense attorney client. And he said, "Pat, this is not the way you write an expert report." I had never seen one. I didn't know any better. He told me how to correct the report so that it would follow the appropriate procedures for the state in which this case was located. And I learned from his feedback. I would much rather that you learn from us than you hear comments like that from an attorney. Now, the attorney, once I rewrote the report, was very happy with it, gave my name to his colleagues, gave me names of other attorneys I could approach and use his name for a referral. I appreciated his opportunities that he opened up for me by giving me a list of 5 plaintiff and 5 defense attorneys. I didn't realize that that was a big ask. I thought that that was just a reasonable thing to ask for. And I got 5 attorneys from the defense and 5 attorneys from the plaintiff, contacted them all. I got work from all of them. And he and his partners gave me work from that law firm for the next 15 years. So it was worthwhile me producing a great report. It was a case that ended up with the plaintiff attorney opening up his checkbook and giving his client money and telling her, "Here's money from my law firm. Go away. Don't bother me anymore." My client called me up. He was laughing. He said, "This case has been dismissed with prejudice." I said, "What does that mean?" He said, "It means that she took money from her own client to drop the case." Now, I said, "Does this thing happen very often?" He said, "No, Pat, this is not something that we typically do." She left. The case disappeared. In the next 30 years, I've never heard of anyone paying off their client to disappear. So it indeed was a rare occasion. And that's why we strongly encourage you to take advantage of the resources that we offer. Get experience with us, build your confidence if you're new or you want to expand your LNC expert role. We're here to help you. We love helping people. And let's put the code in the chat one more time, Barbara.
Yes, lnc.tips/analyzing. So once again, that's June 5 from 10 a.m. until 4:30 p.m. Eastern Time. And a great time to analyze medical records. You are going to leave with practical tools that you will be able to utilize right away. And that will be a full day education, and there will be many opportunities that you'll be able to ask your questions. I know we've gotten several questions, great questions here, and we're running out of time. So we encourage you to join us and ask your questions during our session, our full day workshop.
Thank you, Barbara, and thank you all for being with us today. We appreciate your attention, your questions, and your dedication to your business. See you next time.
Have a great day. See you soon.
Coming up next, you'll have an opportunity to hear from 2 experienced plastic surgery nurses who are legal nurse consultants, Kenna Morgan and Grace Flack, who are my guests on Legal Nurse Podcast. we took a look into what goes on behind the walls of the operating room and how some of those events can result in liability issues for plastic surgery staff. What were some of the topics that we covered? Tell our listener what they can expect to hear about during your show.
Yeah, so we talked about the expected complications after plastic surgery, and sometimes those can be, people don't expect the complications. So it's really important to know what is normal and what is not. And we also talked about how a nurse might actually become a defendant in a plastic surgery case. And that's when, the surgeon wants to do one thing, but the nurse knows that it's not right. So it's really up to her to voice her concerns and document everything.
Yeah, and we also touched on just knowing when to look at final results of a procedure. If a patient's not happy with the outcome of their procedure, when kind of the timeline as to when they could move into the legal aspect of it, just knowing what the outcomes are and when they're final, actually considered final. And then we also touched on an important subject with huge legal implications, just safety as far as fire risks in the OR, because that is such an important subject and can be truly life-altering for patients, and it can be devastating financially and legally to everyone involved.
Thank you, Grace and Kenna, for sharing your knowledge, and you'll have an opportunity to find out a lot more about this topic when you watch their podcast on plastic surgery. See you then. Thank you for being part of the Legal Nurse Podcast audience. I'm delighted that you've joined us for this episode. Be sure to go to legalnursebusiness.com and get your free reports. Look around the website, pick up some tools that will be useful for you in your legal nurse consulting practice. And be sure to join us for the next episode.